Hi, I'm Nick Powell, City Hall Bureau Chief with City and State. Joining me on today's City and State TV is Jill Furillo, the Executive Director of the New York State Nurses Association and a registered nurse. Thank you for joining us today, Jill.
Thank you for having me.
So, Jill, you were also you were honored as one of our Above and Beyond honorees this year for Women of Public and Civic Mind. Can you talk a little bit about receiving that award and what that means to you, just as a public figure in New York City and New York State?
Sure. It was a real honor to receive that award from City and State. I read City and State on a regular basis, as I think everyone in the labor movement, as well as folks who are politically, interested in politics in the state of New York. So it was, I was surprised but honored to receive that award, especially not just for myself, but for our leadership of registered nurses in the New York State Nurses Association, who have been so passionate about the changes that we've undergone and the fact that we've become more politically active as an organization. So to get an award for that was really an honor, and also to be among all the other honorees who are leaders in the state of New York.
Now, you've been at NYSNA a little over a year now, and you came from California, where you were instrumental in getting the nurse to patient ratio bill passed. Now, can you tell me a little bit about that struggle to get that bill passed, and do you have any hopes for a similar legislation here in New York?
Yes. First of all, in California, I was active in that movement from day one, and it was quite a movement that was built by the nurses, by the rank and file nurses and the leaders in California. But what we were able to do there was to get a lot of support from community organizations, from other unions, from elected officials, people in the senior movement, from the religious community, and we were able to, after 8 years of building that fight, we were able to achieve the first nurse-to-patient ratio bill in the country. And since that time, the patient care has improved dramatically in that state. Hospitals have done very well. They've made more money as a result of the implementation of that bill. And it's still in effect today, so many years after it was won in the legislature and implemented. It's actually been 10 years since the bill was implemented, and everyone's done well. So the nurses in New York have seen those results and very much believe that implementing similar type of legislation here will be in the best interests of patients and our communities who access care in hospitals.
Now, how does this relate to, I understand there's a big fight against the for-profit takeover of the public hospital system in New York State. So you've talked about how, the improvement in patient care in California with the bill, but can you tell me a little bit about the union's efforts to to make sure that the for-profit takeover doesn't occur, and why is this such a big concern for not only healthcare workers but for medical patients statewide?
Right. So going back to California, one of the main reasons why the nurses in California went to the legislature to try to get the legislature to weigh in on this issue was because of the proliferation of for-profit hospitals in the state of California. The for-profits were proliferating, and they were setting the trends for patient care delivery, and it was very dangerous because those hospitals operate strictly on bottom line. They're not looking at nursing, they're not looking at the medical profession. The decisions that are made are not made by medical doctors or by nurses or anyone who has a medical background, but rather those folks who are doing the investments and figuring out what's going to sell best on the stock market. So as a result of that, the patient care standards began to be eroded, and the not-for-profit hospitals, in order to compete with the for-profits, there was this downward spiral. Everyone was rushing to try to make the same kind of money that the for-profits were making at the expense of patient care, and as a result of that, that's why the bill was passed, because everyone believed that the standards had been eroded. So after having lived through that experience, I'm able to bring that message to New York and to say, we don't have for-profits right now, and based upon what we've seen that for-profits do nationwide, we can stop that here in New York. We don't need to have that kind of you know, destruction of patient care standards, and actually it also contributed to a growing nursing shortage because people were leaving the profession. So as a result of that, we fought very hard in New York to keep the for-profits out, and we've been successful. We've had 2 years now where it's been in the budget bill and also even in legislation, and we've been able to, through our discussions with legislators and discussions with the executive office, et cetera, we've been successful in being able to keep the for-profits out. And we'll see what happens with the rest of the year, the legislature, whether or not these bills are going to come back and there'll be another attempt. But right now we feel pretty good about the fact that we've been able to keep them out.
And I understand that a big priority of NICENA's this year was getting safe patient handling passed.
Yes.
And I understand that was also a big priority of the AFL-CIO and organized labor in general in the state. Now, this bill has had momentum before and it's stalled. What made this year the right year to pass that? And do you think it being an election year had anything to do with that?
I do. I don't want to say election year per se, but I do know that there was that the executive did include it in the bill, in the budget bill, and so that was a different approach than what we had ever actually done before. In the past, it's been a bill in the legislature, and we've all lobbied for that through the regular legislative session. But this year, the executive did include it in the budget bill. There was support everywhere for it, and we are happy and grateful that that got passed. We do believe that there needs to be the safe staffing legislation that goes, is a companion bill to that safe patient handling, because you can have good equipment for safe patient handling, which is what this bill will, mandate. But you also need to have the staff present to be able to operate the equipment appropriately. And so those two things go together, but certainly winning the safe patient handling bill is a win, and we're really happy that it got passed.
And you and I have talked about this in the past, but in the city, we're dealing with obviously some public hospitals that have fallen into very bad financial disrepair. So what is NICENA doing to kind of, raise awareness about what's going on with these hospitals, but also move them towards, an eventual, into a better financial state and possibly keep a long-term healthcare component at these hospitals? For instance, I understand Long Island College Hospital in Brooklyn is now debating whether to accept a bid from, a bidder has some questions surrounding it. Could you tell us a little bit about that?
Sure.
The Brooklyn Health Partners bid?
Well, first of all, I'm just going to back up a bit.
Sure.
And say that when I came to NICENA, together with our board of directors, nurses who would work in all of their leaders in all of these hospitals in New York, some of them in the public hospitals and HHC, others who are leaders in some of the large facilities such as Presbyterian, Montefiore in the Bronx, Mount Sinai, et cetera. We decided together as a group to do an assessment of what's going on in this healthcare industry and what the trends are. And our assessment is that there's almost an unfettered corporatization of healthcare that's taking place and had been taking place over the last 10 years in New York, in the city and also in the state. With this corporatization, what's driving the agenda is a drive for market share. So what you have are these large facilities or large corporations are looking for people that have high-end insurance, and they're looking to get that market, the market with high-end insurance, because they feel that that's where they could make more money. In that drive for competition over the high-end market, what's happened is that lots of hospitals that have a higher mix of Medicare, Medicaid, those hospitals are being left behind, and that population is being left behind with this market share or this market-driven healthcare system. So we as registered nurses are patient advocates, and we advocate for everyone to have health care, no matter which community that they live in, no matter what kind of insurance they have. We believe everyone should have equal access to care. And so what the analysis that we did was that many of the hospitals that have the high Medicare Medicaid mix, they have been getting kind of the short end of the stick, in that the Medicaid reimbursement rates are lower for hospitals that are treating people who actually have more healthcare needs. So that doesn't seem fair to us. Then you have a different kind of mix between access to care in communities that are wealthier, such as the Upper East Side of Manhattan, as opposed to Bedford-Stuyvesant in Brooklyn or areas of the Bronx, that there's actually more healthcare facilities. There are more healthcare facilities on the Upper East Side, and there are more beds per 1,000 residents, 6 in Manhattan as opposed to 2 in Brooklyn, for example. It doesn't seem fair. So our